Welcome, friends. AMR Transmission Dynamics series. Today, I will be talking on very important topic. Uh, how can we control the antimicrobial resistance? So we need not to talk about again what the AMR is and what is antimicrobial resistance, because I have talked a lot on different videos about the AMR and its consequences globally. The current situation is that we have bacteria which are resistant against last resort of antibiotics, including the colestins and all carbapenems. There are several bacteria, bacterial strains, which are emerged from hospital settings, environmental settings, and we found them as they are resistant against even colestin. Why I'm saying even colestin? Because colestin is the last drug left to treat infections when the carbapenems, that is imipenems and meropenems and doripenems, are not working. Now, in this situation, if a person having infection with such kind of a bacteria cannot be treated at all, and that's the reason of a death, and mortality rate is increasing. As WHO has already declared, by 2050, 10 million people will die. It means post-COVID scenario, the 2050 may come early as per the experts' prediction. We may have 2040 or 2035 or 2045 have the same data produce, the death data. So it means 10 million people will die every year by 2050. It could be by 2040 or even earlier or later. Under this situation, we are in a position that not cure even a simple infection. And in this situation, what should be the alternative approach? So my lab is working on that, and for last couple of years I've been working on that aspect. So antibiotics are not manufactured anymore by the companies and by the industries, pharma industries, because all pipelines are dried. No company is taking any interest in developing new antibiotics because they have a great loss in developing new antibiotics, spending a lot of money, and after a year or two again the resistance develop in that, so it's useless. So therefore we thought of in that scenario we thought of to develop some new approach. Besides many approaches we are working on, like vaccine, inhibitors, and phage therapy, one of the approach that today I'm going to talk about, so very simple and very easy to move and easy to adopt, is combination therapy. Now, what is combination therapy? We have tested several antibiotics which are highly resistant, show resistance in bacteria. For example, doripenems and cefoxitin, ceftazidime, tetracycline, and many more, streptomycin. Although some of the antibiotics I have just named are two different groups, whether it is aminoglycosides or beta-lactam groups, but they are highly resistant. So bacteria are highly resistant against these antibiotics. So these antibiotics are no more be useful against the patients having such kind of infections. But what we have shown through certain researches and evidence is that if you work having these two antibiotics combination, even in the lower MIC level and lower concentration level, then it will work perfectly. For example, in one of the studies in my lab, we have worked on doripenem and cefoxitin in combination, and in another study we have worked on doripenem and tetracycline. So when we combine doripenem and cefoxitin and doripenem and tetracycline, it works very well. So MIC goes down. It means the resistance can be controlled through combination. Similarly, in another study we have worked on aztreonam and cefoxitin and ceftazidime. Now, earlier when we test the cefotaxime and aztreonam separately, it will not work. It could not work. But when we combine these two, it works very well. It means these combination of these two antibiotics, and these are all novel combinations. Nobody has yet tested. Then doripenems and cefotaxime, these are another combination where we have checked that when we combine this doripenem and cefotaxime, it works very well. But if we separately work on cefotaxime and doripenem, it shows resistance in the bacteria. In another study in my lab, we worked on streptomycin and cefotaxime. So when we give cefotaxime showing resistance, and again streptomycin again resistance. But when we combine these two at a lower concentration, both of the combination of these two work very well. So what we reached to the conclusion finally, that the combination of those antibiotics which are already showing resistance in bacteria have become perfectly working well against this kind of a superbugs and highly drug resistant bacteria when we combine these. So the conclusion of this study is that if we pharma companies, or if the some people, those who are interested in making these combinations based on some pharmacokinetics and pharmacodynamics of these drugs, can work well. So my study is basically may help to pharma companies to move on and to start making combinations and test in vitro and then preclinical trials, and go to the trials, because these are already tested drugs and approved drugs by FDA. So there's no harm in using these drugs in combination even at the lower concentration. So finally I conclude that having that information generated from my lab, and I have not patented it because patents take a lot of time. So I want now to use these combinations for pharma industries, by pharma industries, and so that it can reach to the clinicians to treat patients and to save the lives of millions of people all across the globe. I'm sure this information will be useful for pharma industries. It should be useful for many clinicians and physicians, and it could be, and all these works is published, so I can also share my papers we publish on that, which are evidence-based data, and that can be further ameliorate and further refined and further tested at the pharmacology level and pharmacodynamics level, so that it can be used by the patients directly. Thank you very much.